Global cooling starts with awareness of the COVID-19 wake-up call to better management of our home environment that we have recently learned from nature. In introduction, COVID-19 is a pandemic which has killed and is still killing millions of people worldwide and was entirely predictable but not prevented. I predicted this in 2005 in a presentation at the World Police Medical Officers Conference in Dunblane, Scotland. Others were aware of these dangers long before this, as was I. Predictable pandemics with far worse consequences, even extinctions, can occur. Virus infections have played a role in our evolution as an intelligent life form, so they're not all bad. Economies worldwide have been disrupted, harming millions of people. Now we all need to know what we can do to protect our families from harm at home. Society, in using lockdowns, has relied on the safety we provide in our homes to protect us and our family from COVID-19 and new variants. Awareness of nature has helped us find better methods of preventing the enormous numbers of deaths. We must start using them today. Validation is shown, but your validation is more important. Personal protective equipment, PPE. PPE is an essential last resort, so has been enforced correctly, in my opinion. Social distancing of 2 meters decreased spread. This is easily validated when we look at smoke exhaled by smokers or our own breath on a frosty day. We see a cloud, most dense where it is exhaled and then thins to about 1 meter away from our mouth and nose. Cloth face coverings partially filter out droplet spread from affected people and partial inhalation of infective doses by non-infective people. All the above contributed to controlling the R number, but repeatedly did not prevent the need for lockdowns or advice to us to stay at home as much as possible. The problem with PPE is that the person wearing it, if infected, could inhale repeated infective doses that they have exhaled. Our normal average respiratory rate of 15 breaths per minute is 900 breaths per hour and 21,600 per day, or 216,000 per 10-day asymptomatic phase period. This is potentially a very rapid lethal dose inhalation and could be the reason why so many healthy first-line workers got lethal doses and died. These consequences continue, but better alternatives are now available. We can do much better than this in our homes, so must do it. Clearly, we may exhale very large, infective, and even fatal doses with every breath and potentially accumulate self-reinfected fatal doses. We now know that infections are spread in all 3 of the asymptomatic phases, the subclinical asymptomatic phase, where no symptoms develop, the pre-symptomatic phase, and the post-symptomatic phase. These stages are mainly at home. We can and therefore must protect our families at home. Continuous diagnostic monitoring in the asymptomatic phase looks difficult, but is it? And if so, is it necessary? Affordable air monitors are available that can measure unhealthy parameters of air in our homes and the air we breathe in and out with every breath. These show us what we already know. This is that the air we breathe is unhealthy and needs cleaning. We continually need to be aware of just how unhealthy the air that we are breathing is. We can wash our air by using water filter vacuum cleaners and then dry it with dehumidifiers. We wash and dry our hands regularly, but in our present polluted world, we also need to wash and dry the air we breathe. If we do this, we will also prevent other pathogens and particles. We breathe continuously, so we need to purify continuously our home and the other air that we breathe, especially during a pandemic. By washing the air we breathe, we can control the COVID-19 pandemic in our homes and other places as well as other diseases. Nature does this with rain and sunshine. We live in places shielded from sun and rain, so we have to use our intelligence to protect ourselves and those we love by internal personal protective management, IPPM. IPPM is management of all sites in the pathogen cycle where this pathogen can be effectively killed or replication impaired. This is needed in addition to PPE, which is essential because it is impairing spread. The number of deaths of people using PPE alone is failure on a colossal scale. We need both PPE and IPPM. Reinfection is clearly the most essential part of COVID-19 life cycle, without which infections may resolve by host mechanisms. Luckily, this can be achieved by trapping the virus in water filtration vacuum cleaners, which have been available for years. A soap or virucide may be added or other methods of killing to achieve this, such as heating. The problem is that very small viral micelles and water particles may not be centrifuged out. By passing this air through a dehumidifier, these micelles will be removed from the air and can be continuously sterilized by the above methods affordably. At home, we can prevent reinfection and also spread. Mutations are also a very important part of successful virus replication. Certain procedures that we use, such as radiations, scans, cause mutation and should therefore be avoided. Hospitals should be specifically designed to manage COVID-19 patients and mutations prevented. Sterilization techniques that use irradiation with UV or UVC light, etc. should be avoided during viral pandemics. It is noted China built special hospitals for COVID-19 very early on. Mutations are the most feared feature of viral pandemics because there are such large infected populations which are ideal for evolution of new strains of mutations repeatedly and very speedily. Vaccines may not always work against a mutated virus. Preventing attachment to infective sites, ACE inhibitor sites, and decreasing dead space in the bronchial tree. Biphasic and virucidal mouthwashes, as well as natural edible oils that decrease the strength of attachment of the virus to ACE sites, will all play a role. But essential to all of this is killing the virus by internal personal protective management. Biphasic mouthwashes already on the market were designed to prevent bad breath, halitosis, by using a hydrophobic effect on the hydrophobic bond binding the bacteria to the teeth. The mouthwash is effective for 12 hours, but has to be spit out. It cannot be swallowed. It is not licensed for swallowing. Modifications can be made and licensed after appropriate testing. The mouth and nasopharynx are an essential area through which the virus has to pass, both on exhalation and inhalation, so doses of virus are possibly decreased twice per every breath we take. It is probable that different methods will be more applicable to different situations. The outcome must be that sterile air is breathed in and exhaled air must be sterilized. Cars, buses and trains, many of which already have vacuum-assisted braking that can be modified so that each seat has access to a vacuum socket to which a personal and transparent shield can be attached. In this way, sterile air is sucked in and contaminated exhaled air is sucked out. preferably under negative pressure, controllably over the mouth and nose. Aeroplanes already have emergency oxygen masks that can be modified to suck air away from around the face or supply oxygen under a transparent shield. In short, all habitable spaces will have to provide sterile air to inhabitants and sterilize all exhaled air. Personal responsibility will rest with individuals, and shields as body warm systems that sterilize both inhaled and exhaled air can be manufactured. Essentially, the trapping and sterilizing apparatus does not have to be heavy and large and can be worn in a light satchel on the back powered by a battery operated fan. Zoonotic reservoirs can be sterilized in the same way during the day when bats are asleep. Insect-eating bats play an important role in our ecology and health, so it is the virus that we have now distributed to bat populations worldwide that needs to be killed and not the bats. Bats have evolved as flying mammals because of the efficiency of their respiratory system, which is 175% more efficient than humans. Bat infection cycle in COVID-19 involves humans mainly because we are so numerous and via aviation have been able to spread this pandemic far faster than would have occurred naturally. It is very important that we realize that bats only get an asymptomatic to mild form of COVID-19 compared to the lethal human pandemic. By understanding the reason for this, we can learn how to control and eliminate this pandemic in them and us. Bats have evolved an ability to decrease inhaled doses, whether it is their infective dose or, more importantly, their reinfective doses. Bats mainly only get asymptomatic or mild COVID-19. There are known reasons for this. Bats are the only mammals that fly, and in order to fly, they had to evolve a respiratory system that is 175% more efficient than humans in order to produce the energy required. Bats have a decreased chance of catching an infective dose when they fly during the day because they fly fast through any pockets of the virus and have very little time to inhale for inhalation of an infective dose as the air flows fast past their nose or mouth. The same applies to any reinfection doses that may be expired when infected. Not only are infective doses less likely, but so too are fatal doses. During the day, bats sleep upside down. This enables gravity to pull virus particles out of their respiratory system. Humans at work are exposed to indoor concentrated pockets of high viral load and are upright, so gravity pulls the virus particles down deep into our lungs. Our lungs are upright when walking or sitting most of the day. It is only when we sleep that gravity will not play much of a role, and it is often for less than 8 hours a day that we sleep. Gravity also pulls the abdominal contents of the respiratory system down when the bats hang upside down. This creates a downward external positive pressure during expiration, resulting in a very good expiration with very little dead space remaining at the end of expiration. This results in far less viral load to infect the closed alveoli, which are closed by the pressure. This is the opposite in human upright expiration, where gravity pulls the abdomen down and the respiratory contents system downwards, opening the alveoli with a bigger percentage of dead space and viral load being drawn into open alveoli. Bats have a very large proportion of their muscle mass attached to their respiratory system, which also serves as their powerful flight muscles. In stark contrast, humans have a very small proportion of their muscular mass as accessory muscles of respiration. Our main muscle mass is associated with walking or using our arms and legs. During inspiration, even when hanging upside down, the powerful flight muscles provide powerful net negative inspiratory and expiratory pressures. This plays a role in the greater efficiency of their respiratory system and enables flight by forfeiting their ability to walk. During respiratory distress caused by COVID-19, bats have therefore far more advanced accessory muscles of respiration and better able to cope than humans. Even though gram molecular volume is a universal rule, bats have evolved advantages in using it that humans have not. Whatever the liquid or solid converted into respiratory space, it will have a greater volume because the respiratory pressure in bats is always negative and lower than humans. Bats have advanced echolocation and positional systems that work day and night far better than our natural ability to see at night. They are social animals able to sleep while some of the group are partially awake, looking out for danger and giving warnings. Bats are likely to be able to survive pandemics that could make humans extinct, especially if biocrime warnings continue to be ignored. Certainly they will thrive if global warming warnings are not heeded and changed into global cooling endeavours that are effective in producing cooling in nature, in controlling our population explosion and changing our behaviours. Humans, in contrast, are the most intelligent life form on Earth at present. We need to use our intelligence and listen to and act upon warnings that are obvious. I have warned about lethal pandemics for 30 years and have not been the only one. We must prepare now for far worse pandemics and have these essential public health measures legally in place, functional and monitored. Public health measures have relied on us protecting our home environment by lockdowns every time the R factor gets above 1. This is a warning to us, all of us, that if we do not keep our home environment safe, we will be at the mercy of new pandemics, and we have seen pandemics have no mercy on anyone. In summary of the human effects, it has now been shown that the changes to the virus that caused the COVID-19 pandemic are its ability to, firstly, produce a high viral load, infective or fatal dose, and secondly, to expire that load rapidly to multiple people and infect them, the R factor. It is not surprising that high viral loads during the infective phases caused a raised R value, which has been the focus of preventing disease spread. Washing hands, face coverings, social distancing, lockdowns have been essential, whether we like it or not. Similarly, the second ability to expire the infected dose rapidly to many people raises the R factor and can also be preventable by the above behavioral changes. In addition, since infection is air spread, we need to sterilize by washing and drying the air we breathe, and which is at home our room air. This can be done by removal of virus at the site of replication, most affordably in our homes. Mutations. Firstly, we need, in addition to prevent mutations by avoiding irradiation, both in hospital and outside. During a pandemic, there is a very large world viral load, and any single mutation can adversely affect the R factor, as has occurred already. Notably, it has occurred before vaccines have been developed and deployed. The potential for resistant strain has already occurred and continues in the ongoing HIV pandemic is a very real possibility. Using our intelligence, we can learn from bats and kill the virus more effectively than bats can. We humans can prevent reinfections at home, where most infections occur. By so doing, we decrease the viral load and the chance of mutations. Spread is therefore completely prevented or decreased, as are less referrals to hospital, less death, less long COVID, less economic harm, less mutations. This we can and must do at home and also wherever people are. By monitoring our healthy, washed and dried room air, we can prevent some cancers earlier and remove carcinogens from the air we breathe. Everyone must provide healthy air for everyone to breathe. Our own ownership of the health of our family is the best place to start. Motivation may be needed to start, but will be driven by success and financial reward. We need to put the infrastructure in place now, or future pandemics are sure to follow and can be far worse. Evolution or extinction can be caused by a new or unexpected virus. We are the most intelligent life form on our planet at present and are able to control our destiny. Let us do it together. In conclusion, we can't just leave it to public health to protect us in future, or environmentalists to look after our homes. We have to do this ourselves, and by doing so, we will improve our environment and allow our children to enjoy their school years without fear for their safety or that of their grandparents and family. We all need to work together to achieve this return to normality as soon as possible. We have the knowledge and the technology to achieve this, so it must be done now, or many more of our loved ones will continue to die and continue to be harmed. All rights protected, lease of rights negotiable. Thank you, and I hope we can do this all together and achieve it. Bye.